No more mosquitoes transmit diseases. According to research, there are more than 80 types of diseases spread by mosquitoes. Mosquitoes that can transmit diseases in my country can be roughly divided into three categories. One is called Anopheles mosquitoes, commonly known as Anopheles mosquitoes, which mainly spread malaria. The other type is Culex mosquitoes, which mainly spread filariasis and Japanese encephalitis. The third type is called Aedes mosquitoes, which mainly spread Japanese encephalitis and dengue fever. 1. Dengue fever and dengue hemorrhagic fever. Dengue fever and dengue hemorrhagic fever are acute infectious diseases caused by dengue virus and transmitted by Aedes albopictus or Aedes aegypti mosquitoes. Sudden high fever. The body temperature rises to 39 degrees Celsius to 40 degrees Celsius within a day or two, and the body temperature often persists for a week. Body pain. I feel headache, orbital pain, muscle joint and bone pain, and the whole person feels very tired. Redness. The skin of the face, neck, chest and limbs becomes red, seemingly, drunk, and even conjunctival congestion, superficial lymph node enlargement, gum bleeding, etc. may occur. Rash. Mainly measles-like and hemorrhagic rash, not higher than the skin. At present, there are no specific antiviral treatment drugs, and supportive and symptomatic treatment measures are mainly adopted. The treatment principles are early detection, early diagnosis, early treatment, and early mosquito prevention and isolation. 2. Malaria. Malaria is caused by Plasmodium and is transmitted through the bite of female Anopheles mosquitoes. There are more than 70 species of Anopheles mosquitoes around the world. This is because malaria attacks often occur periodically. Generally, during the attack, there will be obvious chills lasting for about 10 minutes to 2 hours, trembling all over, pale complexion, and cyanosis of the lips. Then the body temperature will rise rapidly, often reaching 40 degrees Celsius or higher. The complexion will be flushed, the skin will be dry and hot, irritability, and high fever. After about 2 to 4 hours, the whole body is sweating profusely. After sweating, the body temperature drops to normal or below normal. After a period of intermission, the above attacks began to repeat again. The most important thing to prevent malaria is to prevent and eliminate mosquitoes. 3. Japanese encephalitis. Japanese encephalitis, also known as Japanese encephalitis and Japanese encephalitis, originates from Japan and is mainly transmitted by Culex tritanorensis mosquitoes. The affected people are mainly children and adolescents. Most infections in humans are asymptomatic or cause nonspecific febrile illness. Less than 1% of infections result in neurological disease and are often severe, with high mortality and neurological sequelae in survivors. In the first 1 to 2 days after the onset of Japanese encephalitis, symptoms such as fever and headache, accompanied by nausea, vomiting, and drowsiness, are common, which are similar to those of a cold. Most symptoms of Japanese encephalitis will worsen 4 to 10 days after the onset, and some may even cause coma, convulsions and respiratory failure. Early diagnosis and treatment are the key to treating Japanese encephalitis. The source of Japanese encephalitis infection is livestock and poultry, mainly pigs. Almost 100% of piglets are infected after an epidemic season, followed by horses, cattle, sheep, dogs, chickens, ducks, etc. Among them, young pigs that have not passed summer are the most important. Animals can have viremia for 3 to 5 days after infection, causing mosquitoes to spread the infection. The most important thing to prevent Japanese encephalitis is to get the Japanese encephalitis vaccine in time. 4. Yellow fever. Yellow fever is an acute infectious disease caused by the yellow fever virus. It is spread by Aedes mosquitoes and is mainly prevalent in Africa and Central and South America. The case fatality rate can reach up to 50%, and the incubation period is usually 3 to 6 days, but can also be as long as 10 days. After yellow fever virus infection, 5% to 20% develop clinical disease, and the rest are latent infections. Mild symptoms may only manifest as fever, headache, mild proteinuria, etc., without jaundice and bleeding, and will recover after a few days. Severe cases can generally be divided into 3 stages: infection stage, poisoning stage and recovery stage. Important complications include shock, intestinal bleeding, heart damage, multiple organ dysfunction, DIC, bacterial pneumonia, mumps, etc. Vaccination is the most important means to prevent yellow fever. 5. Filariasis. Filariasis is an acute parasitic disease caused by filarial parasites in lymphoid tissues, subcutaneous tissues and cavity membranes. It is transmitted through mosquito bites, mainly Culex pipiens and Culex quinquefasciatus, followed by Anopheles sinensis. Acute lymphangitis and lymphadenitis can occur after infection with filarial worms, mostly in the lower limbs, with periodic attacks, accompanied by high fever and chills. Filarial fever can also occur, with periodic attacks of chills, fever, aversion to chills and fever, possibly spermatic chorditis, such as epididymitis and orchitis, may occur.